We will focus on only one drug in this lecture, captopril. Captopril is the prototype of ACE inhibitor. It belongs to the therapeutic class of antihypertensives. Working directly on RAS, captopril prevents angiotensin I converting to angiotensin II. Therefore, it stops a cascade of vascular and adrenal-renal responses. Subsequently, blood pressure decreases and cardiac preload and afterload also decrease. The iconic adverse effect of captopril is the constant irritating dry cough, which spontaneously stops after the medication is discontinued. Other common adverse effects include hyperkalemia, loss of taste, and angioedema. Captopril is primarily indicated for hypertension, and it is also used as an adjacent medication for heart failure. In addition, it is the drug of choice for treating hypertension in diabetic patients. Use captopril during pregnancy could lead to injury or death to the fetus. Therefore, it is contraindicated during pregnancy. Also, it is contraindicated in nursing moms. As a matter of fact, you will see that medication working on RAS are contraindicated for pregnancy and lactation. Nursing care for patients using captopril includes the following. Patient educations cannot be taken easy for those who take long-term medication therapy at home for chronic condition. Patients should be taught about adverse effects, monitoring, managing, and reporting to the physician if experiencing any adverse effect. Monitor blood pressure and heart rate prior to administering medication. Prevent orthostatic hypotension by avoiding abrupt position changing, especially from lying to standing. Changing position slowly allows physiological adaptation to readjust blood pressure to support adequate cerebral perfusion. Patients should allow themselves 2 to 5 minutes between position changing. Advise the patient that first dose hypotension will ease after a few days. Teach the client to take captopril 1 hour before or 2 hours after meals. This medication is usually prescribed twice a day, 2-3 times a day. It is important for the patient to know the interactions between captopril and other medications or food. Patients should be taught to prevent hyperkalemia by not using salt substitute. Using salt substitute only if consulted with a physician or with a physician's prescription. Female patients should report pregnancy to physician. Stop captopril and changing medication in order to continue managing hypertension. Monitor blood dysgraphia and renal function with routine CBC, BNP, and urine analysis. Patient should call 911 if experiencing chest pain, shortness of breath, and difficulty breathing. Teach the patient on interactions between captopril and other medications, or between captopril and food. Alescarine can increase risk for renal impairment. Antacid may decrease captopril effect. Using captopril and allopurinol together increase risk for hypersensitive reactions and possible infection. Angiotensin receptor blocker, ARB, should not be used together with ACE inhibitors because these two groups of medication share very similar therapeutic mechanisms, which means using captopril together with an angiotensin II receptor blocker will increase toxicity, leading to undesired adverse effects. Diuretics and other antihypertensives can increase risk for hypotension. Potassium-sparing diuretic would add risk for hyperkalemia. ACE inhibitors can increase levels of lithium, increasing lithium toxicity. NSAID can decrease the antihypertensive effects of ACE inhibitors. Here we have a list of ACE inhibitors and the individual side notes. Thank you for spending time with me. I look forward to seeing you again in the next lecture.